Well, howdy, friends. It's Nicole Zaagman at Parkside Farm. It's that time of year, it's spring, and so if you are a farmer or own livestock, we are getting and gearing up to the birthing season for spring. Maybe you're already in it if you've got cattle or sheep. Maybe you had some animals born already this season. We are anticipating our first kidding of the year with our pygmy goat, Stella, and as we have a few more days to wait, I wanted to show you and do a little educational video about what I put in my kidding kits. So if you have goats, maybe this is your first year breeding and you're really unsure, what to put in a kidding kit. I do have a few years of experience and several kiddings under my belt. And so this is a bucket I've got to the side here that I'm going to pull out and show you. And I will happily make a list of items that I recommend as well. So something new I'm going to start off with, I just ordered this. I saw this on one of my friends' kidding kit lists, and I thought, you know what, for $85, this would probably be something important to have on hand. So what this is a lamb or kid resuscitator. So this actually works. There's a couple of different attachments here that would go over, I haven't even opened it yet, it actually came today, would fit over the nose and the mouth of the baby kid or lamb here. And then this would attach to it on this end. And what this does is help to inflate the lungs. So if you've got a kid that's born or a lamb that's born, maybe it's got a very shallow or soft heartbeat and it's not breathing on its own, you could use this resuscitator to try to get the kid or the lamb to breathe again. And it works by pulling and pushing this in and out, and there's directions on here. I have also read that it works to clear the lungs, hopefully, and the nasal passages of any mucus and things that maybe you wouldn't be able to get out just with a mouth to mouth or mouth to nose or bulb aspirator. In the instance where your mama goat may not have had a smooth, easy kidding, maybe you ended up with a C-section and she's just not taking to the kids, or something, God forbid, happens and you can't milk colostrum out. It's always handy to have some kid colostrum powder on hand, so I always make sure that I have that. Always check your expiration dates. One that I had expired, so I went ahead and ordered this. But you can pick that up. Tractor Supply usually carries it. I ordered it off Amazon. When you're in the middle of kidding, obviously things can get a little bit messy. In terms of messes, one suggestion I've read is to have empty grain bags. So I have one of these, and this works real well to just throw down on straw and let the kids kind of be laid out and born on that. Oh, you know what I don't have with me? I just did laundry and I haven't folded them and put them with my kidding kit here. But you want to have lots of extra clean towels as well. So if you use that empty grain bag, you've got those towels. You can use those to help dry off the kids. You can use them to wipe off the mucus off the nose and get their airways clear. I also find having these little sanitary pet pads are a really handy thing as well. I'll often put this just underneath, tuck it underneath the doe's rear end, and it helps to catch a lot of all that goo and blood and mess, and then you can just kind of wrap it up and throw it away. That is also very handy. You can use it as well to put your freshly born kids on if you don't have the empty grain bags. It's just a nice little sanitary option, and then you can get their umbilical cords dipped in an iodine solution before they have any access to the bedding material. Obviously, we all want things to go incredibly well. Sometimes they do, sometimes they don't. So I've had pygmy goats again for 5 years. And then prior to that, when I was younger, I had them for a good, I want to say, decade or so, and had many kiddings during that time. We were not as prepared, I guess, when I was younger. We just didn't have a lot of issues, and I attribute that and thank the Lord for that, because I, was a little unprepared when I restarted my herd to have so many kidding complications right after one another. It's taught me a lot. I've learned a lot, and then everything that I experience, I take that and turn it around and turn it into an educational lesson for the families that come and take my goat care classes, or the school groups that come in that want to learn more about goat husbandry. Next on the list would be to have some OB lube. Also order these tubes on Amazon. This is non-spermicidal sterile lubricating jelly for animal use only. I've used this on nearly every kitting I've had. This will be my 6th kitting since I've restarted my pygmy goat herd. Very handy. You'll probably end up using that. This also has an expiration date on that, so if you have some on hand, just double check your expiration dates. I do have a stethoscope here. It makes me feel official sometimes, but you can always end up using this if you need to check the heartbeat on a newborn kid or kids. I like to make sure that the mama's temperature stays normal, so if they've had a rough kitting, they've had a C-section, or even if it was just a rough pull on them to get those kids out, and you had to go in, meaning you put your hand inside to help manipulate a kid or pull the kid out, you want to give that animal antibiotics just to make sure that nothing was introduced that would cause some sort of internal infection. One of the fastest ways to check for infection in a goat is to take a rectal temperature. So I keep digital thermometers on hand. These are just little thermometer sleeves that you can slide the end into and then just get that temperature read really quick. I have that in my kitting kit. Let's talk about some kitting snares, I guess you could call them. These are 2 different models that I have, and I have not had to use them. I'm not going to say I'm never going to have to not use them, but I have them on hand in case I need to use them. So for positions where the head is malpositioned or turned back down, I've heard and read lots of people end up having to use these little kid pullers to get them in and up and around a head or even a leg. And this one has a little sliding mechanism here so you can hold that taut around the head or the leg and manipulate it into the position that you need it to be able to get that kid safely out. This one is a little bit bigger. It has a handle on it. These can be purchased online as well. I'll try to include the links for those. Those are just excellent items to have in your kitting kit. I've never had to tube a baby goat, but again, just because you never have to do something doesn't mean that you shouldn't be prepared in the instance that you need to do it. So I do have some syringes with some tubes to be able to tube babies to feed them. And one of the big things you need to make sure before you feed a baby goat that's having trouble, that's not nursing on its own, is to make sure that its temperature is within normal range before you feed it. There's different protocols you can do to try to warm a cold kid up. People wrap them in bags and stick them in bathtubs, like hot, warm baths of water. You could use heating pads, bringing the animal in from the outside elements. Thankfully, I have not had to do that, but I have read that a lot of people have, so just something to keep in mind. We talked about the Resuscitator at the beginning. These are handy little, these are actually for infants. This is a newbie Breathe Ease nasal aspirator. So I haven't had to use this either, but I have it on hand. What I have used is actually in my dishwasher. I just washed a whole bunch of things. I went and grabbed those couple items out of my dishwasher to show you as well. So these are the 2 bulb syringes that I have. This one is a little bit different. This one is a little bit larger. It had a couple of different attachments that came with it. This one is a really teeny tiny one, and I've actually used this one the most because pygmy goats are just so small. Their little noses are so small when they're born. So you just stick it right in, squeeze it, pull it out. Maybe even use one of those pet pads that I showed you earlier and just, wipe this on the end and go back in, suction more out. So that's if you don't have a lot to remove and you're just kind of clearing the airways and you don't need to try to go in and remove anything from the lungs, like with the Resuscitator or the mouth aspirator that I showed you. But this is an example of one of the baby bottles. It's just a human baby bottle that I've had on hand. And so if you end up having to bottle feed any of the kids, these work really well. They've got these smaller nipples and my goats seem to really like them. And then a pair of sanitized little scissors, just in case you need that. Have that in your kitting kit as well. You will also want to have some sterile gloves. These are a small, medium. I have smaller hands. If you have larger hands, you can get larger ones. These are very helpful if you have to go in at all. I typically put them on even if I'm, barely assisting, just to try to keep everything sterile, not introduce bacteria and germs into mama. These are food grade gloves, so I think I got these at Menards. Those are very handy. Going back to just keeping things clean, you can get pet wipes. Got these at Menards as well, just in the pet section. They're just quick and gentle, clean wipes, helps remove dirt, reduce odor. So if you want to clean mama's back end up a little bit, maybe yourself after you've delivered your kids, these are really easy to have on hand and utilize to keep things clean. This is just a small pet bottle I got at Tractor Supply. So with those little tiny newborn kids, especially the pygmies, they can be really small. Sometimes they have trouble latching on to a larger goat or lamb kid nipple. Sometimes these smaller bottles work well. Dental floss. You can use this to tie off your cords on your kids before you dip them in your iodine solution. So this is a Providine iodine surgical scrub solution that I have used in the past. It is a 7.5%. I've read and researched that your iodine solution that you use to dip your navel cords, or where the umbilical cord is on the babies, should be around 7%. So if you happen to have something that's a 10% solution, you can dilute it down to that 7% ratio. But this one happens to be 7.5%. So this I've just used directly on the umbilical cords and the navel. So if you have kids born that have misshapen ears or curled ears, you can often just use surgical tape to tape them. I also have, I'm going to try this out in case I have some still as babies born with that. This is self-adhering Altris wrap. Sometimes it's hard to get the tape off the ears after you've had it on there. So I was going to give this a try and see if this works any better or worse. Mama goats go through a lot when they're kidding. It can be very stressful on them. So I do have a little bag of Dumore multi-species electrolyte supplement. A lot of people give their goats warm molasses water after they've kidded just to kind of perk them up. Often I will also make sure that my mamas get a B vitamin injection at some point just to boost and stimulate their appetite, especially if it's been a rough kidding. These are a couple of oral things that you can have on hand. This is a vitamin B complex. It's an oral gel. So again, if your mama is stressed, you can utilize this and give it to her orally. Lamb and kid paste, it's Durazyme. It's also, it's a live microbial enzyme paste that you can give to them. I think this is, yeah, for lambs and kids. So you would feed 3 to 5 grams on the back of the tongue of newborn lambs or kids. So something to have on hand. This is Jumpstart. I've used it a lot. It's a probiotic paste, and it is multi-species as well, but I found that it works really good with my goats. Again, after kidding, probably give mom a little dose of that. Everything that I just showed you, I have in this sterile food grade bucket. It's nice to have everything contained in a bucket or a basket, like a plastic, you could use like a laundry basket or something like that, that you could set on your barn floor and then not worry about all the items in it getting germs and bacteria on them. And then you can store it in an area until you're ready to utilize it. That is pretty much everything that I keep in my kidding kit. I'll get a list made of everything. Let me just go over a couple of imminent kidding signs that I found helpful with my own experiences. So every goat's going to be different. I'm going to put that out there first and foremost. Every kidding experience will be different. Even the same goat kidding over and over again may have different outcomes and different positioning when they're delivering the babies. Just like people, goats are just all different. For Stella, for instance, with her, and most of my other pygmy goats, these are the couple signs that I watch for. I hand breed my goats, so I know exactly when their due dates are going to be. That's really important for me because I have had those kidding complications. I want to be sure that I am available and ready to assist if needed. And with having 3 C-sections in a row unexpectedly, I had to be there. I'd have lost all the babies and all the moms had I not been closely monitoring and watching them. For me, knowing first and foremost when the kidding dates will take place. So a goat is pregnant for about 5 months. It's 145 to 155 day range. I find that the pygmies are closer to that lower end range, maybe versus some of the larger breeds. And my pygmy does have all gone between like day 145 and day 150. I don't think I've ever had one go beyond that. And I calculate that date on the first breed date. Stella has kidded on day 145 and day 148. I'm hoping and thinking she'll probably go around the same time frame this time around. Who knows, may change. But with her and a lot of my other does, here are a couple signs I watch for. So their udder's going to be developing. Sometimes if they've freshened before, it can start developing earlier. Sometimes if they've never freshened, it can, develop earlier. But her udder has been getting a little bit larger over the last couple of weeks. When I know that kidding is probably going to happen within the next 48 hours or so, that udder is going to fill a lot more, and the closer we get to the actual active labor window, that udder is going to fill really tightly and be really taut. It's getting bigger now, but it's nowhere near, I don't think, where it should be if she was going to be kidding imminently. So that's one thing. A lot of people like to check the ligaments above and around the tail. Sometimes those can come and go, and I've not been real successful at being able to judge that, but I do feel for those ligaments, and I feel that the smaller breeds sometimes are a little bit harder to feel those. Once that rear end kind of just goes completely mush, that's a good indicator that it could be within 24 to 48 hours, I would say. I clearly watch for what we call goo, or just that mucus string. Now, some goats can lose that mucus plug a lot earlier, a lot later. I've never had a goat that has lost any sort of mucus until they're like an hour within active, a couple hours, usually at the most like 2 hours before active labor. So I'll look for that kind of that clear string of goo. That's when I know things are going to happen pretty quickly and the goat's going to move into active labor. As I'm talking, I'm thinking through other scenarios and things that I've gone through, and I guess I'll just give you a couple of the kidding scenarios that I have experienced that not that I wasn't prepared for, but it didn't go the way that I had hoped it would. The first kidding, once I restarted my herd, was with my doe named Iris. She went into active labor. She was actively pushing. However, she never progressed with a baby. So once you see a goat's water break, if you are monitoring them very closely after, for me, that string of goo comes, you should see some sort of water breaking, a gush of fluids come out. And for me, I want to see active labor, active pushing, and a baby hopefully within 30 minutes. At the most an hour. So I knew at the 30-minute mark, even at 20 minutes with her, I knew something wasn't quite right. So I lubed up and I went in around the 30-minute mark, and she was just not dilated, could not find baby, could not get my hand past my knuckles. It was very tight. I ended up calling the vet out, and she was exhausted by the time the vet got there. She had pretty much stopped pushing. Thankfully, Samson hadn't progressed into the birthing canal, so we were able to do a successful C-section on her and get him out, and she ended up taking to him by the next morning and was an excellent mama with him. Now, her daughter, Belle, bred her shortly thereafter, or like a year after that. Maybe it was only 6 months. I can't think on the fly here with the math. However, thought we'll breed her. She was 14 months. So I typically now wait till my does are 2 years. I don't know that waiting for 2 years would have made a difference with her, because what happened with her situation, she had a single buckling. And when she went into active labor, she was pushing. Baby Samuel's head started to come out. We could see his mouth. We couldn't get a hand in. Her pelvis was just too small. So again, middle of the night, whisk her away. We ended up taking her in to do the C-section. Her mama C-section we did right in our goat garage with the help of our veterinarian, and his daughter actually came out that evening to help. But with Belle, we took her in. She was just a little bit more exhausted. We thought having a sterile environment would be better. We ended up doing the C-section on her. It was successful. She lived, and baby Samuel lived, and I ended up bottle feeding him because she just didn't want anything to do with him, and that was fine. She was pretty traumatized, and I don't blame her after that whole situation. One other item that I wanted to point out that I haven't had to use on my own, but I have on hand just in case, is portable oxygen for the baby goats. So one of the C-sections we did have performed. The second one, The baby was stuck in the birth canal, and it took quite a bit of effort to get him out, and he had a purple tongue. His mouth was a little crooked. I ended up having to syringe feed him for a couple days before he could take bottles, but we gave him oxygen at the animal hospital. But if you are not able to get to an animal hospital, having this portable oxygen on hand can be very helpful. So this is paw print oxygen. You can order these kits. They come with 3 canisters here. It has a regulator that plugs in the top of these canisters that helps you determine the flow of oxygen needed for the animal that you're working with. And then there's these little attachments. So this would be a face attachment that you could put over the nose and mouth. Very similar to the aspirator we talked about earlier. This would administer that oxygen directly to the baby and hopefully get it on its way and breathing much better. You can order this online. This is a very handy thing to have in your kitty kit. My third C-section was with another doe, completely unrelated to the first 2. Didn't think she'd ever have any issues, but I also had trouble finding her baby on an ultrasound. We had to do a couple ultrasounds to determine if she was actually pregnant or not. Her makeup physically was much different than the other 2, and she really hid that baby well. But we knew she was pregnant. I knew her due date, and she ended up going into labor, I believe, on day 143. Anything less than 145, the lungs are the last thing to develop in a goat, and those last 2 to 3 days are critical in making sure that the lung development is there for those babies to be able to breathe on their own once they are out in the world. And so I knew if she delivered the baby that there was a possibility that the baby wouldn't make it because it was a few days early. She actually never went into active labor and never pushed, and we ended up having to take her in for a C-section as well, and the baby had already passed away, sadly. But I think in that instance, the baby must have passed before she went into labor. Baby wasn't alive to trigger her body to actually go into active labor. 3 different situations. The first 2 were pretty much the same outcome. The third one was a little bit different, and obviously we ended up losing the baby, but she is here, saved mama, and for me, like, that's a win in this situation. Farm life isn't always easy. Things can go crazy. Stella's last 2, her first and second delivery, pretty much textbook perfect. I did have to assist getting her first baby out because she was just so tight. I ended up having to help pull the baby out, but perfect presentation. I think she had 1 little foot under her chin here, and that's what we want. We want the babies to be in a diving position with either both feet under their chin or next to their faces here, or 1. Her second kitting, I think the first one, his little head was just coming out first, so I did have to reach in and find a leg to pull him out, but pretty easy compared to a lot of scenarios, like when twins can get tangled and breech positions and when heads are back or down. So I will take a head first any day. That's the ideal situation. I really hope this video has been helpful for you. I will link as many products as I can so that you can add these to your kitting kit. Hope you have a great day, everyone. Take care.